General physical examination is an important part in clinical examination of the patients. Let it be cardiovascular, let it be CNS, let it be GIT, let it be respiratory. General examination of the patient is very important. We have to see from the head to foot of the patients. We have to see whether the patient is fully conscious, cooperative, alert. Then we have to look for whether the patient is a tall individual or a short individual, depending upon the case you may come across. Then a tall individual, in addition to the height, we have to see the arm span, and we have to look for the length of the fingers. Then if it's a short individual, we have to see the webbing of the neck, very important. Then see whether the patient is having musculoskeletal deformities. Sometimes there may be emphysematous chest, sometimes there will be pectus excavatum, sometimes there will be pectus carinatum. Very important. Let it be an abdomen distension. In addition to the finding, we have to look for the abdominal girth examination. Then, not only sign, we have to look for the evidence of pallor, cyanosis, jaundice, and we have to look for the evidence of edema on the lower limbs. Then the neurocutaneous stigmata of some diseases we have to look for. Under that we have to see whether there is any telangiectasia, evidence of tuberous sclerosis, evidence of neurofibroma or K-Foley spots we have to look for. Then coming to the general examination finding, I have already mentioned looking for the pallor, jaundice, then cyanosis, pedal edema. Upper limb we have to look for the evidence of clubbing. We have to look for tangential, and there is another sign for the Shamroth sign we have to look for. Then move to the vitals, pulse examination. We have to see pulse, whether it is regular or irregular. All the peripheral pulses we have to feel and compare. Then depending upon the condition, we have to look for the pulse in the upper limb and the lower limb and see whether there is any radiofemoral delay. Then we have to look for the BP, upper limb, sometimes lower limb, depending upon the situation. Sometimes we may have to record the BP in all four limbs. Then looking for the cyanosis, we have to look for the evidence of cyanosis in the lips, in the oral mucosa, in the tip of the nose. Sometimes even at the extremities we can see cyanosis. Then if there is a gross clubbing, we have to look for evidence of hypertrophic pulmonary osteoarthropathy. See, if it is a respiratory case, from the symptoms, you have to look for the evidence of Horner syndrome. And then we have to look for the general examination, evidence of lymph node enlargements, that in the cervical region, axilla, growing, there will be significant lymph nodes. Then respiratory system dysfunction, sometimes this musculoskeletal deformity in the form of wasting, then kyphosis, scoliosis, then pectus excavatum. All these things are very important in general examination.